I'm Gill Morgan. I started my career as a doctor, worked in various branches of medicine, in general practice, in hospital, in public health. Then I became a manager. I ran a health authority. I ran the NHS Confederation, and my last 4 years of working, I was the permanent secretary to the Welsh Government. And 2 years ago, I was very privileged to be appointed as chair of NHS Providers. I think the NHS at the moment is in quite a challenging position. Everybody knows about the money, but I think there are some underpinning challenges that make the role of governors quite important. And I suppose the biggest issue for me is about leadership within the system that we now have. The Act created a number of arm's length bodies who provide central guidance and leadership. But at the heart of most of what goes on a day-to-day basis for patients are foundation trusts and trusts. They're the organisations that treat patients 365 days a year, 24 hours every day. And they're the bit of the system that's linked in particularly to governors. Now, I think it's particularly challenging for them because they're trying to work with a climate of financial pressure, and the comprehensive spending review will have helped, but it's made what would have been an impossible year a challenging year. They are the organisations that have to balance the money with quality, because quality, what we do for patients, is the most important thing for the NHS. And in this really troubled climate, they have to think beyond the boundaries of their own organisations to work out what's best for all the patients in this patch, not just the people who come through our doors or into our mental health organisation or get into our ambulances. They're also critical in thinking about quality because they're patients. They have a contact with hospitals, with community services, with mental health organisations, with ambulance trusts. It's about the people who use those services. And that voice is absolutely critical, because at a time of trouble, it can be very easy to focus on the things that people up there tell you are important, rather than things that we all know are important to the people here. So governors have to keep people true to quality, to patients, and ask the patient story. And sometimes that may not always be welcome, but they have to do it. That's what governance is about. How do you think about the whole community rather than just the needs of the people who use our bit of the system? And again, governors live in that community. They have a responsibility to be asking that question, which is, if we do that, what is the impact on all the patients in this community? They need to be asking, well, wouldn't it be better if we worked with those people? Or why aren't we working with those people? Or what's social care doing? Those sorts of questions about the system and the community, I think, are absolutely critical. I think it's really important that governors are given support. It can be very difficult coming into the NHS and to work with people. We use really complex technocratic language. We use initials when words would do better. And it can be very hard to start to work in that environment and know how to intervene in a way that helps the organisation, but also gets the sort of answers that people want. So one of the things we do in the NHS Providers is our Govern Well programme and the support that we put in for governors and also for non-execs, because they too have some of the same problems. We think it's really important that governors understand what the system is, how you make decisions, how the NHS as a whole runs, but more importantly, that they understand at a local level what the key challenges and the key issues are. But they don't get that knowledge just by osmosis, by sucking it in from the environment. And that's the sort of thing that we think Govern Well can help people with, can help people frame the questions, understand the finances, and understand too some of the national initiatives that are there at the moment that I think are going to help boards, but also help governors understand what more can be done. So I'm thinking there particularly of the Lord Patrick Carter work, which has been looking at productivity in hospitals and measures of efficiency. And he's coming up with a lot of work which will give really detailed comparisons from unit to unit. Hospitals at the moment, but it will extend to the community and the mental health, which will allow people to say, we do quite well in this area, or, oh, we're not so good there. And helping organisations identify the, oh, we're quite good, and the, we need to do some more, seems to me to be something that trained governors can be really helpful. I think the first has to be the money. It's understanding the finances in the organisation and asking the simple questions, but being very supportive of management as they begin to think of solutions to the problems, because some of those solutions are going to need changes to the way we do services at the moment, and governors should help and support those rather than just worrying about their own institutional. The second, and this is the most vital thing, is keeping people true to the quality of the services we deliver for patients. Governors are patients. Governors are embedded in communities. They know what works and what doesn't work, and they need to be able to say and raise those things with managers. And the third challenge, and this is quite difficult because, you know, as a governor, you're very proud of the organisation you're attached to, but increasingly the problems facing the NHS with older, iller, sicker patients with lots of illnesses need solutions across boundaries between organisations. They need the community to work with the hospital, they need GPs to work with mental health, they need ambulance to be at the heart of what we do. It's a very different world from a world where organisations could achieve what they wanted individually. So governors have to ask the question about this community and how do we, and you as our managers, how do we do the best for all the patients in the community, even if that means blurring some of the boundaries that we once held sacrosanct. If governors do those three things, they will make a real impact for the future of the NHS.